Good morning, everyone, and thank you for joining us. My name's Mike Thompson. I'm the Triad Coordinator with our SVP of Dane County. Got a really nice crowd today, and we've got a terrific presentation from Ingrid Kundinger of Wisconsin Senior Medicare Patrol. Ingrid, if you could give us a little introduction, a little bit of information about you yourself and how you got into the Medicare fraud business. Well, not that you're committing any Medicare fraud, of course,
No.
How you got into looking for the fraudsters. Okay.
Sure, thank you. Absolutely. Thank you so much for inviting me to join you this morning, Mike. It's certainly great to see everyone here this morning, and hopefully there'll be some important information that you can take back for yourself to share with friends and family, perhaps other organizations that you're a part of. My name is Ingrid Kundinger, as Mike mentioned, and I am currently the project manager for the Wisconsin Senior Medicare Patrol program. And by the end of our time together this morning, you will understand what that program is, how to connect with us, and all the other good things about that. But a little bit about myself before we get started. I have spent a pretty significant part of my professional career working in the aging network focused on older adults. I spent some time in long-term care facility management, specifically with folks with memory issues and Alzheimer's and dementia. I did some fundraising work for the Alzheimer's and Dementia Alliance of Wisconsin, as well as several other organizations. I was the executive director of the West Madison Senior Coalition for a number of years, overseeing all of the resources and programs that were provided there to help to keep older adults in their own home of choice for as long as possible. And then I saw this opportunity to join the Wisconsin Senior Medicare Patrol program to have an opportunity to connect again with the aging network, as well as Medicare beneficiaries and family members across the state of Wisconsin, and share this important information. Before I joined Senior Medicare Patrol, to be honest with you, I didn't realize that Medicare fraud was as significant of an issue as it is. And so it feels good to be able to share this message with folks on a daily basis and be a friendly voice on the other end of a helpline telephone for people who are extremely stressed out by maybe a phone call that they received or a package that they received that they weren't expecting. Just being able to provide some support and some next steps is a good feeling. So that's kind of a little bit about me. And I will share this. All right. Everything look good on your end, Mike?
Looks good, Ingrid. And if you'd like this presentation, Ingrid's sending it to me. I can make it available to you if you'd like to send me a note, okay?
Perfect. Thank you. So today we're going to talk about Medicare-related fraud and the Senior Medicare Patrol. So here's kind of our agenda about what we're going to talk about during our time together this morning. As I mentioned, the Senior Medicare Patrol program here in Wisconsin. I want to share some things that we hear on a regular basis about Medicare fraud in Wisconsin and how it is impacting Medicare beneficiaries right here in our own backyard. I'm going to talk to you about Medicare fraud and provide some logical or practical steps or things that you can do to help protect yourself from Medicare fraud, and then also share with you some available resources that we have at the Senior Medicare Patrol that may be helpful to you or other people that you know who could be potentially impacted by Medicare-related fraud. So let's just start at the top. What is Senior Medicare Patrol, or SMP? The SMP program is a federally funded grant program through the Administration for Community Living, and there is a program in all 50 states across the country, as well as the 4 U.S. territories. In Wisconsin, the SMP program is housed at the Greater Wisconsin Agency on Aging Resources, which is also known as GWAR. So that is our host organization. And our main office is located in Madison. However, we are a statewide program, and so we have a responsibility to share all of our resources and information with the folks across the the state of Wisconsin in all 72 counties, as well as the 11 federally recognized tribes. One thing to know about the Senior Medicare Patrol program is that it's volunteer focused. The program began in the mid-1990s as a result of concerns that were building as it related to Medicare fraud and how that was impacting Medicare beneficiaries. And so when this program started, the intention was that it would be very much volunteer driven, boots on the ground in communities across the country, providing important information to Medicare beneficiaries about how they could protect themselves from Medicare fraud. And then one thing for you to know is that all of our resources that I will mention later, all of the information that we provide, all of that information is complimentary. There's no cost to any of our programs or resources. And all of the information or conversations that happen via our web or our helpline, are confidential. So really quickly, the mission of the Senior Medicare Patrol program is to, as it says here on the screen, to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So that sums up pretty nicely what it is that we do and how we go about doing it. We provide information and empowerment to Medicare beneficiaries. The key words that you'll hear me talk about again are prevent, detect, and report. And we do all of these things in a number of ways through outreach, counseling, and education. Here's a little bit about how or what it looks like in terms of mission delivery for the SMP program. We find ourselves, now again, I'll put an asterisk by this. This was before the pandemic, and as we start to slowly re-enter the communities across the state, you would find us at booths across the country or across the state, health and wellness fairs, senior expos, senior resource fairs, at senior centers or maybe libraries or other community locations. We love to be involved in those events, staff booths at those community events to share our information with people and let people know that we're a resource here in the community. Oftentimes, as we're talking with people, they say, I had no idea that you exist. And maybe that's why some of you were interested in this program today. You had no idea that the Senior Medicare Patrol program was even a thing that could be a resource for you. So we do welcome those opportunities to speak directly with folks at events such as a senior resource fair. We also are available to give presentations similar to the one that we're doing today. We can do those virtually, we can do those in person. We can kind of create the time frame that fits best for you. We can do presentations as a PowerPoint presentation similar to today. We also have an engagement activity that's more of a booklet of kind of word puzzles and that sort of thing that we work through together with the group that's involved, and we get through all of our information in that way as well. So we're available to do presentations to any sort of group, big or small, doesn't matter. We'd love to have the opportunity to do that. And then lastly, we provide confidential assistance via our toll-free helpline. So we field questions and calls from Medicare beneficiaries, maybe family members or caregivers across the state on a daily basis of people who have been impacted by Medicare related fraud or perhaps have a concern that maybe they were impacted. So that's what mission delivery looks like for us. You would find us out and about at the community. If you're someone who works for an agency that provides this sort of service to folks, the end of the presentation will provide contact information for how you could reach out if you are interested in having us join you at an upcoming event or perhaps share our information via a presentation as well. So now I told you that we have the Senior Medicare Patrol program, but maybe you're wondering why it's even necessary. And as you can see here on this slide, Medicare fraud, abuse, and errors is a $1 billion industry for the fraudsters on an annual basis. And nope, unfortunately, that's not a typo. I didn't mean to write million. It truly is billion. The current estimate for Medicare-related fraud to the system on an annual basis is around $60 billion. Now, I don't know about you, but like I can't really wrap my head around how much money $60 billion is. But as I see Medicare summary notices and other things that people share with me as it relates to this, I understand how quickly all of those things can add up to be in the billions. So that's why this program is necessary. We, on an annual basis, are able to help the Medicare program recover monies also in the $1 billion range, unfortunately not at the $60 billion level range, but we do play an important role in helping Medicare recover some of that fraudulently spent money. And I'll talk about how we do that in just a bit. So when I started working at the Senior Medicare Patrol program here in Wisconsin, I thought, you know what, I bet that it's not really that big of a deal in Wisconsin. It doesn't happen to people in Wisconsin. It doesn't happen by people in Wisconsin. And unfortunately, I learned very quickly that that in fact wasn't the case. So I'm going to share with you a bit of information and just kind of the top 3 scams or things that people call our helpline for currently as it relates to Medicare fraud. So the first one that I'll talk about is new Medicare card scam calls. The second one being durable medical equipment scams. And then the final one being cardiogenetic testing scams. So the first one, new Medicare card scam calls. So if you are a Medicare beneficiary, you may remember that in 2018 into 2019, Medicare did change the format of every Medicare beneficiary in the country's Medicare information. Prior to that time, a person's Medicare number was their social security number with a letter or something at the end of it. Now, obviously, you probably can see that that would be a huge issue if someone's Medicare number was their social security number. There's a whole host of issues, not only as it relates to medical identity theft, but identity theft in general with someone's social security card or social security number being so easily accessible. So Medicare made the decision in 2018 to change the format of everyone's Medicare information. So it's no longer your social security number. It is now a randomly generated alphanumeric number. As you can see on the sample card here on the slide, John L. Smith's Medicare information or his Medicare number is 1EG4, et cetera, et cetera. So the hope there that it was something that people wouldn't be able to easily memorize or that they'd actually have to physically go to that card to remember the information. Most of us are able to rattle off our social security number pretty quickly, but this one being a little bit more complex, the goal was that that wouldn't be as quick to be shared with folks as a social security number. So everyone received their new card, the paper red, white, and blue card, nothing fancy about that card. And everyone does now have that randomly generated alphanumeric number. Shortly after that, the calls started about all sorts of scams related to that new Medicare card. Initially, they were making sure people had that. Did you know that we could laminate it for you for a fee? I mean, all sorts of scams just related to this card. Well, fast forward to the pandemic, this seemed to be a new area for the fraudsters. And they always tell us anytime there's uncertainty as it relates to pretty much anything that would be in the mainstream news, something that maybe is gray area or something new or something that people have a lot of questions about, that's where the fraudsters step in. They capitalize on the uncertainty. And so as we were learning more about COVID-19 and, concerns with all sorts of, initially with what it was and what it meant to us, we were talking about personal protective equipment. Then we started talking about vaccines. The fraudsters were there with all sorts of scams related to COVID, also including new Medicare card scams. So people started receiving calls that said, hey, did you know that there was a new card? It's not, your red, white, and blue card isn't going to be valid anymore. There's a new card, it's red, white, and black. It's because of COVID. Medicare has some new COVID benefits, so they've issued a new card because of that. That's not true. People continue to receive calls today from people who are saying, hey, did you get your new Medicare card? And then oftentimes people will say, well, no, I didn't know there was a new Medicare card. So just that quick interaction allows the fraudster to think, oh, I'm going to be able to be successful here. So people are being told that there's a new plastic or like credit card type Medicare card. That's not a thing. They're being told that it needs to have that little chip card or chip code in it. That's not a thing. They're saying that it needs to be laminated. Maybe that it needs to have your physician's name on it. None of those things are in fact true. The Medicare card that you have, the red, white, and blue paper card, is the card that Medicare has issued. There's not a new one for any of those reasons. So our suggestion to folks is that if you have someone if you answer the phone and someone says something to you about a new Medicare card, don't even interact with them if you can possibly help it, and hang up the phone, because what they're looking for is for you to verify your Medicare information, and then they're going to go ahead and figure out how they can submit claims to Medicare, fraudulent claims to Medicare with your information. And we'll talk about that in a bit, but I see there's a couple of chat questions, maybe not questions. Nope. Okay. Just making sure. So they're looking for your information. So you maybe think, well, what are they going to do with my information? That will trigger the next most popular Medicare related fraud scheme that we hear about, and that's durable medical equipment scams. So usually when I'm doing a presentation in person and I start to talk about durable medical equipment, which also means the back braces, the knee braces, the elbow braces, the ankle braces, any sort of body part that could have a brace, people start to shake their heads. Yep, they've received calls about that. They've seen commercials on television about that, or a friend or family member has received phone calls about that. So that's what the fraudsters are looking for. First, they want you to verify, that's the popular buzzword there, your Medicare information, and then they need to be able to submit a claim to Medicare for payment for something. So most often that something is some sort of medical supply, like a brace for some sort. So the phone call for this goes something like, hey, I'm either calling on behalf of Medicare, or I'm calling from XYZ medical supply company. And I was just wondering, we're calling Medicare beneficiaries today to see if they are experiencing any sort of pain. Well, most people, certainly most older people, would be able to say, yeah, I have some sort of pain when asked that question. So then as you're talking with them, they're just going to, they usually start with the back brace. If you say, nope, back pain's not something that I usually have troubles with, but let me tell you, my knees, they give me trouble. Well, guess what? The person on the phone would love to be able to share with you the best knee brace on the planet, or at least that's what they might tell you. And the best part about it is that it's going to be free. Medicare is going to cover the entire cost of it. And again, just need to verify your Medicare information with you, and we'll get that sent to you. So I'm going to give myself a little time out here. I have to first say that I'm not by any means saying that durable medical equipment is not helpful to people. It absolutely is. I'm also not saying that Medicare shouldn't pay for the cost of these things. They absolutely should, and they absolutely do. What I am suggesting here is that instead of talking to a random stranger on the telephone, or calling the 800 number on the television commercial that you see in the middle of the night, my suggestion to you would be to talk directly with your healthcare provider regarding this sort of equipment. And here's why. Medicare is going to cover the cost of that, but there are certain rules and requirements that need to be met in order for Medicare to pay for them. And the first one is that your doctor needs to write a prescription or an order for this sort of equipment. And it needs to come from a healthcare provider that has seen you, like eyes on you physically, or in the telehealth world, they may be able to do a doctor visit via telehealth if someone is unable to be in the clinic or for safety reasons. But that has to be someone that's known to you. So now you're probably thinking, well, then how is this such a big deal? Unfortunately, there are physicians, healthcare providers all across the country who are willing to risk their medical license to write orders for this type of equipment for these durable medical supply companies without seeing people, without ever having talked to them. They just take the information from the person who calls you on the phone. So they would say, hey, Dr. Smith, I just talked to Ingrid on the phone, and boy, we got a good one here. She's got knee troubles. I think we could probably send some ankle bracelets along with her. She verified her Medicare information. So here you go. Here's all her information. Write an order and we'll submit that claim to Medicare. So they do. They submit the claim. You may or may not get a box or multiple boxes of medical equipment sent to you. And then you'll see the paperwork catch up later, where Medicare in some cases has paid hundreds or thousands of dollars for this equipment that maybe doesn't even fit you properly, isn't truly what you wanted, or more importantly, isn't something that your own doctor ordered. So this is a huge problem for the Medicare system. And you maybe are thinking, well, Medicare needs to do a better job of catching these sorts of things. And I agree with you on that. However, we need to also remember that Medicare processes between 5 and 6 million claims a day. So they can't possibly catch all of those things or be on the lookout for that sort of thing. So that's where, Senior Medicare Patrol comes in. That's where conscientious healthcare consumers come in to, pay attention to what's happening as it relates to that. So again, the most important takeaway here is that if you've ever received that call for a back brace or a knee brace, or if you will receive that going forward, again, my best suggestion to you is to hang up the phone. They're just looking for trouble. They're just looking to cause you trouble. They want to submit claims to Medicare without really having to do any serious or actual work for that. So if that is something that you think you could benefit from, please work directly with your healthcare provider for that equipment that you may need. Then the final type of fraud that's reported on a regular basis to us is what we call cardiogenetic testing scams. So you may have received a phone call about this as well. People report having received phone calls about cardiac issues in your family. There's been a little bit of a COVID-19 switch to this because in some cases, people have had cardiac issues as a result of a COVID-19 diagnosis. So the fraudsters are taking advantage of that as well. And so, someone would say, hey, is there other cardiac issues in your family? And if you go on to say yes, they've got the perfect recommendation for you. They're going to send you a DNA test kit so that you can learn more about that. So again, here, as you can see, they're just needing to verify your Medicare number so that the cost will be covered by Medicare. So there's an important catch here that I think is you should just keep in mind is that Medicare does not cover a cardiac genetic test except in very rare circumstances. There's a lot of prior diagnoses that need to be on your file, and your doctor needs to write up quite a bit of information as to why this cardiac genetic test would be necessary for you. So just someone randomly calling you over the phone could in fact mean that you yourself would be on the hook for covering the cost of this sort of test kit. I think sometimes people got confused when they received phone calls about this. They're talking about DNA. We often see television commercials about people doing their family tree or kind of the genealogy. And so I think sometimes people thought that that's what they were participating in and not realizing that there was a link to Medicare for that. And so again, it's just important if this is some sort of test or you do have cardiac issues and you have some concerns, again, We encourage you to talk directly with your healthcare provider or your cardiologist, if you have a cardiologist, about that to see if something might be available to you. Again, hopefully you're developing a theme here, you're sensing a theme. If you answer the phone and it's someone that you've never talked to before, it's someone calling you out of the blue, asking you personal health care information, asking for Medicare information, like that's a huge red flag. Like they're up to no good. Your best bet is to simply hang up the phone so that you are not dealing with these troubles down the line. Let me just check this and see what this, so there's a there's a comment. What does it say? You just got a card in the mail that looks legit, saying it's a Medicare notice for Dane County, saying there are new plans with additional benefits many fail to claim, such as adding $170 back into the Social Security check, $2,500 for routine dental work. There's a phone number then called to check for eligibility for your free Medicare review. I'm glad that someone brought that up. I have copies of that similar postcard on my desk that I've received from folks in the northern part of the state. I think the ones that I have are from Barron County. So my suggestion to you on those, yes, they do look somewhat legitimate, but that is not coming directly from Medicare. If you look at the very fine print at the bottom, I don't remember if it's on the front of the postcard or the back, it says in super tiny print that you probably wouldn't notice otherwise, that it is not endorsed by the government, by Medicare, that it is in the instance of the ones that I have copies of, it was from a company called Go Health. And what Go Health is that it's an insurance company. So they are providing Medicare Advantage plans and all sorts of other insurance products. So if you made the decision to call that phone number, just be prepared that you will be speaking directly with an insurance agent or an insurance broker, and they will do everything in their power to try and get you to switch to whatever plan that they're offering to you or saying that you're eligible for, because there's a commission on the line for them. Now, I'm not saying that all insurance folks are sketchy or nasty, but we certainly see a number of them that are. And the reason I say that is because oftentimes those plans aren't available in the area that you live, or there's some key things that that insurance agent isn't providing information to you for when you might call. Maybe it's really important that you are able to continue to stay in the provider network that you currently are in. And once you would switch plans, you wouldn't be able to see those doctors anymore. Maybe there's medications that you're taking currently that are covered by the current plan that you have, but when you switch to a different plan, that they wouldn't be covered. So we always suggest that when you're getting those mailers in the mail or you're seeing the ads on television, just be aware that that's not coming directly from Medicare. That is coming from an insurance company of some sort, and they've got something that they want to sell to you. Now, could you perhaps save some money with a different plan? In some cases, absolutely yes. We suggest at the Senior Medicare Patrol that you connect with your local Aging and Disability Resource Center. There's an Aging and Disability Resource Center, or an ADRC, in all counties across the state of Wisconsin. And all of those Aging and Disability Resource Centers or aging units, or even tribal aging units, have staff that are called elder benefit specialists. And they are trained to provide you with unbiased information about Medicare, original Medicare, as well as Medicare Advantage plans that might be available to you based on where you live and based on what's the most important to you. And so I think the most important thing for me to emphasize with that is that, again, just be aware that if you call those 800 numbers, you're going to be potentially aggressively marketed for a new plan. And they may force you or encourage you or make you feel pressure to decide quickly without having all of the information. And so remember that the Aging and Disability Resource Centers across the state are great resources for that. They have staff that are going to provide you with that unbiased information and allow you the time to make your own decision based on that information. So same thing with the mailings that you get, the same thing with the television commercials. And I know that they hire some celebrities, you know, famous athletes from times past and other folks that encourage you. They're offering additional benefits. It all sounds great. And, you know, we find ourselves saying often, if it sounds too good to be true, it usually is. So it looks like someone is noticing the tiny print at the bottom. And there's all sorts of information. And so just to kind of as to wrap up that whole situation, unfortunately, there's a lot of people that have called those 800 numbers, either from a postcard or a mailing or from the television commercial, because, hey, I get it. We all would love to have $170 back in our pockets every month, or the additional benefits that are being offered. I mean, we all are looking for that. But we've seen in some cases that people get switched to plans that are not what they're looking for. And so oftentimes they don't realize that until the next time they go to the doctor, and suddenly they're left with a huge bill because that doctor is no longer in their network. Or they go to the pharmacy to refill a prescription, and suddenly the copay that they were expecting to pay is much higher, or it's not, that medication isn't even covered in their plan, or that they signed up for this plan because of a certain benefit that was advertised on television, but they came to find out that they actually weren't eligible for that. And so I think it's just important that, of course, they're going to lead with all those things that seem, you know, like, great, why couldn't, that would be great, why wouldn't everyone want to do that? So just take your time before you do that. And again, remember that the Aging and Disability Resource Centers are a great way for you to get unbiased information about that. And let me tell you, Medicare and enrolling in Medicare and the different options, it's not easy. And I wish it were more easy to and simple to follow, but there's a lot of steps and there's a lot of, you know, nuances to that. So finding someone who can help guide you through that process, who isn't going to make an additional commission check because they got you to check this box versus that box, I think is pretty important for you to remember. So great question. Thank you for bringing that up. That's important. And you'll probably start to see more of that sort of thing. Every year is during October 7th to October 15th to December 7th is what's called the Medicare open enrollment period. And so that's when you will see a lot of different commercials on television. You potentially could receive a lot of different mailings. You may receive emails and text messages, phone calls. Again, just remember, if you're happy with the plan that you have, that's great. If you are thinking maybe there would be a better plan for you, search out someone who you would trust to help you learn more about those options. All right. So we talked about the most common sorts of Medicare fraud that we hear about on a regular basis on our toll-free helpline. So now I just want to provide some steps for you, things that you can do to help protect yourself. So as I said in our mission, we talk about protect, detect, and report. So I'm just going to cover each of those words really quickly. It's not rocket science, but it's always good to be reminded of these sorts of things. So the first thing is to protect yourself, tips to help keep you safe. Now, most of the time when we're talking with folks who've been impacted by potential Medicare-related fraud scams, it happens via the telephone. As we talked about in those other examples, people call about the new Medicare cards, they call about the Cardiogenetic testing, they call about the durable medical equipment. So most of that stuff is happening via the telephone. So just some tips, and you've probably heard this before, and this certainly doesn't just relate to Medicare related fraud. This would be all sorts of fraud and scams that you may be on the list for, your phone number somehow is on the list for that. So we're always encouraging people, if they have caller ID or if they have a smartphone that pops up the number that's calling, if you don't recognize the number, don't answer the phone. Oftentimes, the fraudsters won't leave a message. They may try to keep calling you a gazillion times, but they won't leave a message. The best way to protect your information is to never have conversations with these folks in the first place, because then you're not going to share any information. Oftentimes I get phone calls from people and they'll be like, you will never guess what I just did. I shared my Medicare information over the phone and I knew I shouldn't have. I've been told a gazillion times, or I've read things, or I knew, but the person on the phone was so slick that whatever he or she said, there was just something that seemed like, maybe this is legitimate, and I shared my number. As soon as I did it, I knew I shouldn't have. Now what do I do? So if you don't answer that phone to begin with, you will save yourself a lot of hassle. I know some people don't have access to that sort of technology, or they don't have a caller ID that alerts them to who's calling. And so they are answering every phone call that they receive because they don't want to miss anything. So again, the tip there would be, if people are talking to you, calling out of the blue from a company that you've never heard of, asking you personal information questions about your health, or asking for information from you, that's a red flag. I would suggest that you hang up the phone. The next bullet point here says, is an important reminder that Medicare, the Social Security Administration, Internal Revenue Service, they're not going to call you. So if someone calls you and says they're calling on behalf of Medicare, or they're calling on behalf of the Social Security Administration or the IRS, they're not. Only in very, very rare cases would any of those agencies call you, and that would be because you would have initiated a phone call to them first with a question, and if they weren't able to answer that question while you were on the telephone with them, they would have asked your permission to call you back once they gathered that information. So I would say that's a very, very small percentage of the time. So if someone calls you saying they're from any of these governmental agencies, those are what's known as imposter scams. They're thinking that if they tell you that it's Medicare on the phone, you're more likely to believe them because, oh my gosh, you don't want to be out of compliance with Medicare. So you're going to provide them with whatever information they're looking for. As it relates specifically to Medicare, if there ever were questions about your Medicare account or your Medicare benefits, you would receive a letter via the United States mail from Medicare that would outline what the concerns were, what the questions were, and what steps you would need to take to get that information corrected and how you would go about doing that. So they're never going to call you out of the blue and say that there's a concern and that they need you to help fix them. If someone does call you about that, hang up. They're looking for trouble. And I also do tell people, if you get a phone call and they said they were from Medicare and the stuff that they told you seemed maybe legitimate, but you decided to hang up the phone anyway because you weren't sure, you can always find your Medicare card and call Medicare directly yourself. I wouldn't encourage you to rely on the phone number that came across on your caller ID, because the fraudsters have access to all sorts of technology where they can spoof phone numbers and make it look like it's Medicare or a local phone number. So we always encourage people to go back to the source. So look at your Medicare card, flip it over, the 1-800-Medicare number is on the back of that, and you could call Medicare yourself. You would talk to a customer service representative there, and they would be able to reassure you that no one called from Medicare requesting whatever information was asked of you. Similarly, you could call the Social Security Administration or the IRS as well if you got phone calls from those agencies. Another thing that I want to just encourage people to think about is that I know sometimes people, when they answer the phone, or it's a robocall and they're given an option to opt out. So press 1 to speak to a customer service representative, press 4 if you no longer want to receive these phone calls. Don't press 4, because I think what happens with pressing 4 is that you're going to get yourself moved to the top of the list or additional other lists, and you're going to end up getting more phone calls than you even potentially were getting in the first place. So just hang up the phone. Don't interact with any of the numbers that they're asking for you to press in that message. So bottom line here, I'm encouraging you to really consider not ever sharing personal information over the phone with people who call you out of the blue. Just hang up. And I know it sounds rude, and many of us were taught not to hang up on people. It's not polite. But if you think about the fraud that these folks are trying to commit, that's not polite either. And it's going to cause all sorts of trouble for you, and it's expensive to the systems that it's impacting. So you are well within your rights to simply hang up. And I will say here, I know we talked specifically about the telephone, but sometimes people will report that they received suspicious email messages from companies or places. Again, we are encouraging people to not click on any links that would be included in those messages, and to simply not to respond to them, not to click on the links, and to simply delete those messages. And the same to be true with text messages. The scammers, they follow whatever technology we're using more often. And so they are definitely available to be text messaging you as well. So the best practice there would be to not respond and to not click on any links if they were to send you a link in the text message as well. Now, I know a lot of times people call and say, I got 40 calls from the same number today. How do I stop this? And unfortunately, I don't have a quick fix for this concern. However, I do have a couple of suggestions. You certainly should, if you haven't already, or I would encourage you to register your telephone number or numbers. You can also register cell phone numbers on the National Do Not Call Registry. And I know some of you may be rolling your eyes and thinking like, whatever, Ingrid, that doesn't fix it. And I know that it doesn't. It's not 100% foolproof, but it does stop some of those phone calls. One thing that's important to note here, I was just on a national call yesterday, and they were sharing some up and coming things to be aware of. And it appears that there is a donotcall.com website that is often being confused with the donotcall.gov website. And so please make sure that if you haven't registered and you're considering doing that, the National Do Not Call Registry through the Federal Trade Commission is the donotcall.gov website. The .com website, you're entering all of your information in there, and it's likely going directly to the scammers so that they have all your information, and they're going to share that with as many people as they can to take advantage of you. So be cautious of that. I will also say that if you are accessing your information with Medicare online, the Medicare website is also medicare.gov. There is a medicare.com website out there that is operated by insurance brokers. And so if you get those mixed up, you potentially could land yourself with a whole lot more phone calls, text messages, emails that you weren't looking for. So just really make sure that it's .gov website addresses that you're using. You can also contact your phone carrier to see if they have blocking services available. I know on my personal cell phone, I have AT&T as my carrier. And so often there is a service that's provided as part of my monthly service. And so sometimes when a phone call comes up, it'll say spam risk, or it'll say telemarketer, which notifies me that I probably am not interested in answering that phone call. So certainly contact your phone carrier to see if there are any services available to you. And then again, a final reminder, I can't say it enough, get in the habit of not sharing personal information over the phone. So step 2 is to detect how you can detect Medicare fraud and abuse. And so this is really important for all of us, whether we're Medicare beneficiaries or not. We all need to be good healthcare consumers. And so when we're talking specifically about Medicare, we're encouraging people to take the time to review the statements that they receive to make sure that all of the claims that have been submitted with their Medicare information are accurate. So if someone has traditional or original Medicare Parts A and B directly from the government or Medicare, they would receive what's called a Medicare Summary Notice, or an MSN. And that paper copy comes every quarter and would provide all of the claims that were filed with your Medicare information during that 3-month period. If you have a Medicare Advantage plan or for your Part D prescription plan, you would receive what's called an explanation of benefit statement. Again, that's going to provide an overview of all of the things that were, all the claims that were filed with that insurance information during that time period. So it's really important to get in the habit of just opening those when they come in the mail and looking at them to make sure that it's an accurate reflection of the healthcare that you've received. Oftentimes we hear folks that say, oh, it's so many pages or it's confusing, or and I get that, it is. There's a lot of information there. There's a great tutorial on the Medicare.gov website that walks you through all of the different steps and things to look for. But the key things here are to look for services that you didn't receive. If there's a double billing situation, maybe there's x-rays listed on there 2 times, or 2 flu shots instead of 1, or if there's services on there that weren't ever ordered by your doctor, or you're like, why is this on here? That's not ever something that I received. Those are red flags that there could be a problem. Now, having said that, it's not always fraud. The healthcare system is complex. The coding system is complex. We're all human. We all make mistakes, and the people on the other end of that coding process are human. So in some cases, it could be a mistake. And so we're always encouraging people to look at that information, then ask questions or say something if something doesn't seem right. One resource that we provide at the Senior Medicare Patrol is that we have what's called a My Healthcare Tracker. It's just a small notebook type thing. You can see the photo there, maybe not the greatest photo, but something you could tuck in your back pocket or a purse or a bag that you might take to the appointments with you. And if you don't already have a system in place or you're looking for a system, this would be something where you could just really quickly jot down the date, which doctor you saw, and really quickly, did you have lab work? Were there x-rays? Was it just a general visit? So that when you receive your summary notices later in the mail, you can do a quick cross-check to make sure that everything on there is accurate and that there's not something on there that isn't. So that's something that we provide at no cost to folks. If you are interested, you can order that information or order one of those from our website, or you can give us a call. But it's just something helpful that people can use to help keep track of all the things that are going on.
Is that available
lastly,
as Ingrid? Is that available as a phone app?
A healthcare tracker?
Yeah.
It's not, but that's a really good idea. I'm going to jot that down.
Those are so easy to use anymore. I mean, I could see myself putting it, and I mean, it's just so many opportunities for, one of the big problems, maybe you can tell me, doctors, clinics, hospitals administering treatment or whatever that isn't needed.
Mm-hmm.
I mean, maybe you'll talk about that a little bit later, but I was looking through an interesting, I'll bring it up a little bit later when we have more questions. I'm sorry to interrupt you right now.
No, that's okay. No, that's a great suggestion though, about having that available as some sort of a phone app. That's certainly the direction that people are headed, or some folks are headed as it relates to that. So thank you for that suggestion. And then lastly, we're encouraging you to report anything that seems a little bit suspicious. So if you look at your statements and you notice that there's a flu shot on there twice, instead of just, shrugging your shoulders and like, oh, must have just been a mistake, call the provider and ask for clarification. Maybe it was a mistake. And most of the time, if you are pointing out a mistake to a provider, hopefully they are quick to get that corrected. They obviously want to continue to be able to successfully submit claims to Medicare. And if for some reason there's an issue with the way that they're doing that, they could lose the opportunity to be a Medicare approved healthcare provider. So important for them to have the opportunity to make that correction. If you call and you don't get a successful response from that, you can certainly give us a call. If you aren't sure what questions to ask, if you have some questions for your provider, you can certainly give us a call at the Senior Medicare Patrol as well. We can talk through or share some questions that you might feel comfortable asking or things to consider before you make that phone call. We also encourage you to have as much information and documentation together as possible before you either call the provider or that you call the Senior Medicare Patrol, just so that we have a better understanding of what it is that your concern is. And as a reminder, the helpline is free and a confidential service for us here as part of the programs that we provide. Just really quickly, I talked a lot about Medicare related scams. There's a bazillion other scams to be aware of. And as you see this list, you're probably shaking your head. Maybe some of you have been contacted about these. I was just visiting my parents up north this weekend, and my mom said, I know you told me I should never answer the phone, but I didn't have my glasses on and the phone rang in the morning and I wasn't sure who it was, and so I just answered it, and it was and she said, the guy said, Grandma, I'm in trouble. And so she said to him, well, my grandson is 10 years old and he's with me here today, so no thank you, and hung up the phone. But the grandparent scam is alive and well. Maybe some of you have received that. Romance scams, gift card scams, you name it, there's just a lot of things. So the bottom line is to just be careful. Remember, never to share personal information. As it relates to, charitable donations, we encourage you to not maybe handle those things over the phone unless you've initiated the phone call to that organization or that entity yourself, and you know that it's truly them that you're talking to. Sometimes those entities don't even take donations over the phone for this very reason. Get a lot of phone calls from people that say, hey, I just got a phone call about my computer virus protection, and I don't even have a computer, or that their school loan payments are there's a program for them and they don't have student loans anymore. So there's just a lot of different scams out there to be aware of. And so just be careful for all of those things. And again, as I said, if it sounds too good to be true, it probably is. So just keep that in mind as well. Really quickly, I want to talk about how SMP thrives as it relates to volunteer involvement. As I said at the beginning of this presentation, the SMP program nationwide is very much volunteer driven. Here in the state of Wisconsin, we have 2 paid staff and rely on volunteers to help us with all of the things that we're doing throughout the state. And so the opportunities that we have for volunteers to be involved with us currently revolve around helping us distribute information and materials and making sure that that information is available in key places. Maybe it's a senior center or a congregate meal site, or maybe you live in a senior housing community and there's information available to folks. Maybe the Senior Medicare Patrol information could be included in there as well. We also are looking for folks who may be interested in giving or comfortable giving presentations, and then also to help us staff the tables and booths at the numerous community events that we find ourselves in. So we provide all of the training, all of the materials, all of the mentoring, ongoing education, all of the things that would make you successful and enjoy your time as an SMP volunteer. So if you're someone who's looking for something to do in your community, and this sounds like maybe something you might be interested in, we'd love to chat more about that with you. Couple of the resources that we have available. I've talked already about our helpline. I've talked about the My Healthcare Tracker. We also have a new website that we launched earlier this year, smpwi.org. I would encourage you to check that out if you have an opportunity. There's a lot of great information on there. You can also request a My Healthcare Tracker. You can request a presentation, other materials. You can request to sign up to receive our quarterly newsletter, the SMP Scoop, which you can see a little snippet of here. That's we publish that on a quarterly basis. As I mentioned, it provides information about the latest scams as it relates to Medicare. There's always information in there also from the Social Security Administration, the Better Business Bureau, all sorts of other federal organizations with information that might be pertinent or helpful to Medicare beneficiaries and their families and caregivers. So if that's something that you aren't receiving and you'd like to, just let us know. We can send that to you either electronically as an attachment, or we can send that to you as a paper copy in the mail. And all of the newsletters are also posted on our website as well. And then on occasion, we do issue fraud alerts. If we've just published a newsletter and there's something new in the Medicare scam world, we would send out a fraud alert, letting you know what that information is. As you can see here, the last one that we issued was in January of this year, with scammers targeting COVID testing options was the subject matter that was covered in that fraud alert. So lastly, here's the information on how you can contact us. Our toll-free phone number is 888-818-2611. And currently I am the person that answers that phone. So if you call, you will talk to me. If I don't answer that phone call, please leave a message and I will call you back. And people can call the toll-free helpline again to report suspected fraud or abuse or any issues they may have, for training, speakers, or materials, or to inquire about the volunteer opportunities. Again, you can visit us online. You can like us on Facebook at Wisconsin Senior Medicare Patrol. We try to provide mission-related information and reminders about how you can protect, detect, and report suspected Medicare fraud, and also share other important information as well. Or a general email address is there as well. So any questions or comments? I'll go back to this. So if people want to jot that down information, they certainly can. But what questions can I answer, or things you thought I would talk about that I didn't, or other topics that I can be of assistance with?
No one else is going to jump in.
I guess everyone's shy.
Don't be shy, folks. Come on. Ingrid's got a lot of great answers for us, I'm sure here. Now, let me send something into the chat real quick here. I was looking real quick for examples or cases of Medicare fraud. And I happened onto this website from the HHS Office of the Inspector General, and it has a long list of stuff. I mean, it's amazing. And a lot of these are from hospitals and clinics that I suppose they could be mislabeling or miscoding things, but a lot of them seem to be administering treatments or care that is not warranted. You know, let's just take another x-ray.
Right.
Right. Well, that's like an immediate $100 to the bottom line, because that x-ray machine has already been paid for. Right. So how do you know when somebody is giving you treatment that it isn't for you? I mean, you're kind of just the money mill that they're turning.
Yep, that's a great question. And thank you for bringing up this resource as well. I didn't mention the Office of Inspector General, and I certainly will do that. That's a tricky situation. I mean, we always assume that the healthcare professionals are acting in our best interest and really truly have our best interest in mind and are only ordering things that are necessary. And I'd like to say in most cases that is probably true, but in some cases, unfortunately, that isn't. And, you know, that's where it's really important for us as healthcare consumers. And I certainly know, easier said than done, we are all taught that the doctor is the professional and we would never question any orders or any information that they shared with us. But we have got to be more comfortable asking questions, asking why those things are necessary, asking for more information or some time to make a decision about whether that additional x-ray is actually necessary before having that done. And so I think, you know, if you are feeling pressure by that healthcare provider, you can certainly call us. We can report that. I mean, and this is something that I didn't mention, but when people call us and let's say they have their Medicare summary notice and XYZ Durable Supply Company out of North Carolina sent claims to Medicare for all sorts of things that they don't even know who this company is. They don't recognize the doctor's name, and it's thousands and thousands of dollars. We're going to work with that Medicare beneficiary. We're going to collect as much information as possible, and we're going to report that. And the way that we report that is directly back to the Office of Inspector General, or the OIG. And at that level, they're the investigators. At my level, I'm an information collector. So we're pulling together information, we're getting all of the facts, we're getting all of the documentation, and then we send it off to the federal investigators. And should they so choose, they then will say, all right, that's it. I've seen XYZ Medical Supply Company on way too many summary notices. Something's up with them. It's time to investigate. And so here in Wisconsin, we have been involved in some Office of Inspector investigations and ultimately takedowns. There was a doctor who is no longer a practicing doctor in the Edgerton area who was writing orders for durable medical equipment for a number of different companies. And he submitted fraudulent claims to the Medicare to the tune of $26 million, just this one doctor. And of those claims, Medicare paid 13 million of them. So he will not be practicing medicine any longer. He's going to spend some time in federal prison. And he's got some restitution to figure out because he needs to work with the system to get that information back. And when the judge asked him why or how he got involved, he was getting a kickback. So every time he wrote an order and submitted that claim and they got paid, he got $30. Well, I guess $30 meant that that was worth it for him and his medical career. And so there's just, if you look on that website, Mike, that Mike shared in the chat, you'll see all sorts of cases of we learned of a case yesterday that came out of Ohio that was portable x-rays. And they started investigating because there were 141 claims submitted for portable x-rays in either a long-term care facility or perhaps a skilled nursing facility. And the service dates were after the person had passed away. So it's just a matter of time. He was x-raying ultimately dead people. Pretty sure that doesn't happen, or that's not necessary at that point. And so again, he was submitting those claims, and until people paid attention to that, he got away with it. So I think, that too goes back to your question. We have to ask the tough questions. We have to educate ourselves as best as we can. And we have to just really be vigilant about looking at statements. If there's patterns we're noticing or things that don't seem right, we're saying something about that.
A couple of things in the chat box, Ingrid, if you could take a look.
I'm just seeing that. So someone said, I have referred a handful of people to SMP that have fallen for the new Medicare card and given out their Medicare information to scammers. What happens for those consumers? They get a new Medicare card issued by Medicare? Great question. So yes, we do get a lot of those phone calls, and thank you for referring folks to us for that. So when someone calls and says that they shared their Medicare information over the phone, I have a couple of things that I suggest for them to do. The first thing that I suggest for them to do is call Medicare directly, the 1-800-Medicare phone number, and report their Medicare card as having been compromised. Once they share their information at the Medicare level, Medicare is able to look into their Medicare benefits to see if there were any recent claims submitted that seem a little bit iffy. And in some cases, Medicare will make the determination that they can issue a new Medicare card or number to that person. And again, that goes back to the reason that since it's no longer a Social Security number, which as we all know, we get one of those in a lifetime, there's not an opportunity to get another one. There is now the opportunity to get a new Medicare card. And so if that decision is made that that consumer will receive a new Medicare card, the customer service representative will explain to them kind of what that looks like, what to expect. It usually takes between 2 and 3 weeks, for that to be processed and sent. And then along with that will come information for the Medicare beneficiary, because then they will need to present that updated or new information to their legitimate healthcare team so that they have the most accurate information, so that there aren't any claims that they're filing that are legitimate claims that get rejected. The other things that I suggest to folks when they call about a compromised Medicare number is that In addition to calling Medicare directly to report that, I encourage people to be really cautious about unexpected packages that are attempted to be delivered. And the reason I say that is because going back to once the companies have your Medicare information, they're probably going to try to send you something because that's what they're going to submit the claim to Medicare for. So that's when people start to receive a box or boxes of durable medical equipment that they don't want. So my suggestion to folks in that situation is to be cautious. If there's a package that's attempted to be delivered to them and they take a peek at the return address label and it's not something they're expecting, it's not a company they've ever heard of, we encourage you to refuse acceptance of that package. And if you aren't able to interact with the person who is attempting to deliver that package, and maybe it's left on your doorstep or in a hallway or wherever it is that you receive packages, if it seems like something that you didn't order, you're not familiar with, we would encourage you to not open it, write return to sender on it and send it back, because it's really difficult. You probably won't be surprised by that, but it's really difficult to get a hold of those companies to request return address labels to have it sent back. And we certainly don't want for you to incur the cost of your own pocket of having to do that. So those are the suggestions that come along with someone who shared their Medicare information. Let's see, is there any training in the senior living centers to help the caregivers detect this type of fraud? We could certainly come and do a presentation for caregivers and just, give them some high-level things to look for or watch for as they're interacting with the folks that they are providing care to. So certainly feel free to reach out and we could talk more about that opportunity, but absolutely. What is your timeline for getting back to those who might call your report line and leave a message? Do you have a high volume of calls? We have a steady volume of calls. The timeline, we try to get back to people within 24 hours or less. Oftentimes I try to answer the phone live if I can, just so that someone can talk to me. And while our helpline isn't, it's not an emergency helpline, we're only available Monday through Friday during business hours. So it's not an emergency necessarily for the people that are calling it. They're in an emergency situation. They're nervous. They shared information. They're not sure what to do next. And so we realize that, and we certainly try to get back to people as quickly as possible. And we do ask that people do leave a message if they don't get that. And then I call people back, and oftentimes I end up playing phone tag with folks because we always tell people not to answer the phone if they don't recognize the number. And so when they see my number calling back, they may not recognize it or think that it's a scam. And so I'm always going to identify myself by name and by the program that I'm calling from. I will say, I'm returning a phone call to Mike from the Senior Medicare Patrol in Wisconsin, and how people can get back in touch with me. And I will also say that we are in the process, because we at the Greater Wisconsin Agency on Aging Resources have had this grant for the Senior Medicare Patrol program since June of 2018. And so we've been ramping up our services and our exposure, I guess, across the state since then. And so we are starting to see a higher volume of calls. And so we are the very beginning processes of expanding our training. And this will become a new volunteer opportunity for people who are interested in helping to person our toll-free helpline. Thank you. I think I answered all the questions in the chat. Is there something that I skipped over? I don't think so.
I think you caught those.
Anything else? Any other questions? I know I'm over time, so I want to be cautious of that as well. So if you have questions, you want to talk to me directly, give us a call. You can send an email. I'd be happy to talk with you. If you're part of another organization, like I said, we'd be happy to share this information with your group or however we can be most helpful. So again, thank you so much for this opportunity. I hope the information was helpful, and we'd love to talk more with you if that's appropriate.
Let me ask you just one here. To what degree do you work with local law enforcement? What kind of ways would you work with local law enforcement on I mean, these obviously frauds, but they're at the high level, you know, and they involve the federal government.
Great question. We don't necessarily have we haven't established that partnership necessarily with local law enforcement. We're just starting to do that with the tribal police departments. And I think we will expand that. We want to let the police departments know that we are a resource. And the reason I say that is oftentimes when someone will call, they have already called their local police department, maybe they called the county, maybe they called, you know, the Federal Trade Commission. They've already gone through those steps, which is great. But I think that, you know, if someone shared their Medicare information, for example, and then they called their local police department, while the local police department is likely to appreciate that phone call, and they'll certainly collect that information, and maybe they keep track of that if there's numerous calls with the same sort of scam that are being reported, maybe there's then some education that happens. But we want to make sure that the police departments know that as it relates specifically to Medicare related fraud and scams, that we could be a resource for them. So if someone called them and said, they called the Madison Police Department and said, I just fell for a Medicare scam, I think I shared my information, in addition to them saying, hey, thanks for calling, we'll take this information, it would be great for them to be able to say, hey, did you know that there's a Senior Medicare Patrol program? We would suggest that you call them because they're going to have some additional information to share with you about this type of fraud. And then we could, encourage them to contact Medicare and all the other things that I talked about. So that's kind of on the horizon for us. We just haven't gotten that far yet, but definitely an important partnership.
Yeah, that's good. I know Madison has a community policing department, and so they're looking to make connections with organizations like yours, and just create a better standard of living for seniors here. It's really an important emphasis. Anyway, any other questions out there? If not, then remember, if you'd like Ingrid's presentation, just send me an email and I'll send that out to everyone who wants it. Triad events at rsvpdane.org. I'll get that to you. Otherwise, I guess we'll call it a day. What do you say, Ingrid?
Sounds great. Thanks again for this opportunity, and thanks for your great questions. I really appreciate it.
Okay, and thanks everyone for attending today.